My name is David Mochel. I was diagnosed with sporadic inclusion body myositis in 2013. I'm currently the chair of the TMA Board of Directors, and I'm a semi-retired orthopedic surgeon who works part-time in an administrative role as a medical director. So the obvious question, why am I here? And why I am here is to describe my myositis journey from diagnosis to current day. Basically, how did I end up here making this video? And I'd like to highlight some of the key things that I've learned so far. My journey started in 2013, basically with my wife, noticing that I was walking funny. I was pushing myself out of chairs, walking upstairs funny, as she described it, but I would say most importantly, I was scratching the floor when I slid my chair back from the dinner table. Of course, she just redone the floors, so it became very obvious, but I had to push down hard and slid the chair back into the floor, and so she had just had them redone, and within a couple months, I was wearing grooves in them. So she actually had an appointment with for follow-up on her migraine with a neurologist, and she asked that I take it instead. So I did go, and I think I was not expecting much, to be perfectly honest with you, and I walked out of that appointment stunned, as he said, 99% this is something pretty significant and bad, like ALS or limb-girdle muscular dystrophy or other things that were very challenging, and there's a 1% chance that there's something far less bad. So it certainly wasn't I was expecting. And as a doctor, people would say, geez, didn't you notice stuff? And at the end of the day, IBM, at least in my case, came on very slowly and that he didn't really notice much. He sent me to a local academic medical center where I did get the big $1 million workup. I got nerve studies and the MRIs and the muscle biopsies and the blood work, and that took most of a summer. And that was a tough summer, don't get me wrong. That was sort of your reality check of where you are in your life at the time. I was in my low 50s. And it took about 4 months, and we finally got the diagnosis back at the end of the summer that it was that 1%, not that the evil thing that they thought at the time. I was thought to have something called sarcoid myopathy, which is not something I had heard of. We did get another opinion because it did seem kind of strange, which basically said the same thing from another academic institution. So I started down a path of a lot of medical treatments, medicines, infusions, etc., etc. After about 18 months, I wasn't getting any better, and to the credit of the doctor I was seeing, she was very smart and said, you know what, I always had a hunch this wasn't the right diagnosis, but I know this guy, he's really smart. He figures out these sort of challenging cases. So she sent me to him at another place. And he was a smart guy, and I saw him, and he nailed the diagnosis in about 2 minutes. He's basically, he and his fellow, their pathologist looked at the same information and diagnosed me with inclusion body myositis. But keep in mind, it's always easier, and I learned this as in my world as a surgeon, it's always easier being the third or fourth guy in line and having a couple of years and failed treatments under their belt to make the correct diagnosis. So he made the diagnosis, but it was a little depressing in that basically, we asked about prognosis and therapy, and what we got was it's not going to kill you, but there really is nothing that you can do. And I would say that was probably very standard thinking at the time and was obviously somewhat depressing. I kind of had enough doctors at that point, but I think having not a lot of treatment options or plans, I did have a friend who sent me to Mayo, and I did go there for my last opinion. Kind of had enough of it at that time, but it was very helpful. It was very insightful that they confirmed the diagnosis of IBM. We did talk about options for treatment, which they did feel there were some. We did talk about when I should stop operating, even though I was doing a lot of surgery at the time and having no problems. And I think most importantly, what we realized is you're not going to cure the disease, but at least that there are things you can do to improve your quality of life and slow things down. That was very important. So I think I realized at that point I'd entered the rare disease world. So rare disease is basically defined as something that affects less than 1 in 200,000 Americans, which at any given time. So that's what's considered a rare disease. What I also realized is there's about 7,000 rare diseases out there which affect about 30 million Americans. So basically 1 in 10 people you see does have a rare disease, but there's about 7,000 all with various weird presentations. So Rare diseases in general are common. 1 in 10 people do have them, but the problem is that there's so many of them. It's almost impossible for most doctors to keep track of it, which is why you need to see somebody very specialized. And me as a physician, I'd heard of inclusion body myositis. I remember it as an old board question that I think I got right actually in my medical school boards. I only had one patient with it in my 25 years of practice, and I do remember calling up to her doctor at Mayo and learning about it before I did her total hip replacement, and she did really well. So I would say at that point, what was our step forward, or a path forward, I should say. We had a lot of decisions once the diagnosis were confirmed. We knew it wasn't the imminent badness that could be with other diseases, but I think we had to reevaluate things, and I think we looked at the obvious things: house, work, and I think mentally a purpose. That was a biggie for me. I give my wife credit. She was very proactive on the house situation. She was smart. We just bought sort of the forever home. Of course, it sunk all the remodeling money into it and then was diagnosed. So, but we made the decision at that point that a multi-level house was not going to work. So we sold, downsized considerably, and remodeled it to make it accessible down the road if and when wheelchairs and other things like that are necessary. Biggie for me was work. At that point I was doing a lot of total joints, really not having issues. But once I knew the diagnosis wasn't treatable, in my mind, ethically, it was the right thing to do was stop operating. I did see patients for a couple of years and then stopped, and eventually was going to stop altogether, but my employer offered me a medical director position, which I took, so I still do that part-time. I think I did question sort of my purpose at that point, and I did feel as an orthopedic surgeon with a rare muscle disease, I was in somewhat of a unique position to help people who had myositis. So that led me to TMA. I first got in contact with a local support group, ironically, with the patient who I had taken care of on and off for years. Very nice group of people. One of the people in our attendees in the support group was an officer on the board. I learned through the support group about the annual patient conference, which we went to in Louisville, which was fantastic. And I think it was the interactions with the other patients that was clearly the most valuable. We also went to Minneapolis. I started on the board in 2019, and here we are today. I would say, the struggles that I see, it was primarily mental, and physical, but it's as much mental as it is physical. I think our biggie is the loss. I think it's not one loss. It's kind of what they describe as death by 1,000 cuts. It's probably a little dramatic, but I do feel it's 1,000 little losses that just continue on and on. Mentally, that is a little bit tough. Initially, I did feel guilty as the provider for the household that I was going to be a burden for my family. That was a big deal. I think I'm very fortunate that I have a fantastic family, but that was a concern. Giving up work which was as a surgeon was a big part of my identity, and then seeing patients, it was a mental hurdle. For example, the first time, obviously after I'd stopped seeing patients, to come into work, with 2 sticks was very difficult for me mentally, even though you look at, in retrospect, how silly it is. But, people are great, and they're wonderful, and, I'm very fortunate. But that, ironically, was a big hurdle for me. So the question is, how do you get through? How do you plow through something like this? I think a couple things. I do think from a faith perspective, I was raised Catholic, and I do believe that this did happen for a reason. I think my wife pointed out it is an opportunity to help, our family and others, and I believe that. I do believe this is an opportunity here for us. I think traveling around and, as a physician, being on the other end of it was very eye-opening. I would emphasize to people to keep pushing if you are unsure of the diagnosis, in my case, or the treatment, though you may be not able to cure the problem, there is usually something that you can do to help. I would say, once again, as a physician, being on the other end of it, you really appreciate the kindness of all the staff and people out there. It really is tremendous. And what I do find from a care perspective, that multidisciplinary care really does matter. And if you can get that, I think that would be great. I couldn't make it through my journey without the love and support of my incredible wife and wonderful family. I think we need to be aware that there are those who don't have that sort of support, and we need to help them. As my wife says, I do think it's very important to try and give people the benefit of the doubt. If they're having a tough day, you never know what's really going on in their lives. So thank you and for listening, and thank you for your time.